Good evening and welcome to Community Health News Toronto. I am Elisa Hammond. Tonight, Community in Focus examine the challenges facing low income single parent household in Jane and Finch. Our community assessment identifies four concerns: housing insecurity, food insecurity, limited affordable childcare, and insufficient social support. The numbers highlight the significance of these concerns, and approximately 29% of Black Creek residents live below low income measures, while 48% of the households spend more than 30% of their income in housing. In Jane and Finch, approximately 41% of families were lone household parents compared to 21% across Toronto. Although Jane and Finch have strong community organizations and resources, families still experience barriers accessing the support they need. In response, we developed the Jane and Finch Single Parent Community Support and Resource Access Initiative to improve connections to housing, food, childcare, and community support. Our primary political action audience is Toronto Public Health leadership because of its ability to strengthen partnership and support sustainability community health initiative. To explain how this initiative addressed these challenges, we will turn to community health correspondent Arvinder Sandhu.
Thank you, Elisa. The challenges faced by low income single parent families are not simply the result of individual choices. A family's ability to access housing, food, childcare, transportation, and social services is also shaped by the relationship community resources, service organizations, and government policies. For this reason, the initiative is guided by the socio-ecological model. This model explains the health and well-being of influenced by several connected levels. At the individual level, workshops and individual materials will help parents better understand available resources and feel more confident assessing them. At the interpersonal level, peer support groups will help parents build relationships, share experiences, and feel less isolated. At the organizational and community level, stronger partnership and coordinated referrals will make it easier for families to connect with the right services providers. At the broader system level, barriers involving housing, food insecurity, childcare, transportation, and services access can be documented and used to support advocacy, policy change, and political action. Community development principles are also central to the initiative. Single parent will not be treated as passive recipients of sport. Instead, they will be active partners whose experiences will shape how the project is delivered and evaluated. Through ongoing feedback, consultation, and peer leadership opportunities, parents can help ensure that initiative remains practical and responsive to their needs. Ultimately, the goal is not just to provide information, it is to build confidence, reduce isolation, improve access to services, and strengthen collaboration between families and community organizations. So, how will these ideas be turned into measurable action? Community affair reporter Stacy Gardner will now explain the project's goal and the people needed to achieve them.
Thank you, Harvinder. The goal of this initiative is to improve equitable access to housing, food security, affordable childcare, and community support for low income single parent households in Jane and Finch. Over the 12-month project, we aim to reach at least 80 households. We also expect 75% of participants to report greater knowledge of available resources, while at least 65% will connect with at least one needed service through individualized referrals. These objectives will be achieved through navigation workshops, paired support groups, community support guides, individualized referrals, and follow-up support. Key stakeholders includes single parent household, Toronto Public Health, the Jane and Finch Community and Family Center, Black Creek Community Health Center, Toronto Community Housing, child care providers, local schools, and community organizations. Community organization provides trusted space, outreach, and link to services. Community health nurses support education, referrals, coordination, and evaluation. Most importantly, parents contribute lived experiences and insight into the barriers they face. Key stakeholders, including agency directors, program managers, municipal decision makers, and funders, influence partnerships, program approval, and funding. This creates an important power dynamic. Although the single parent best understand these challenges, organizational leaders and funders often hold greater decision authority. To promote meaningful participations, the initiative will provide flexible meeting times, multilingual and culturally appropriate materials, childcare and transportation supports, participant feedback opportunities, and peer leadership role. These strategies help ensure families help shape the program's implementation and evaluation. However, lasting change also depends on support from those with the authority and resource to sustain these efforts. Political affairs reporter Amile Mutumo will now explain who we are asking to act and, most importantly, what we are asking them to do. Amile?
Thank you, Stacy. It is important to distinguish between project's target population and its political action audience. The target population is low-income single-parent households in Jane and Finch. The primary political action audience is Toronto Public Health leadership because they can support community health programs, strengthen partnerships, and influence long-term investment. Our call to action has three parts. First, funding. Fund stable programs, including resource navigation workshops, peer support, outreach, childcare, transportation assistance, and coordinated referrals. Second, partnership. Partner by strengths collaboration between public health, housing, food security, childcare, and community organization. The third one is advocacy. We will advocate for policy and system changes that reduce barriers and promote health equity. The initiative is not asking Toronto Public Health to create new services. It is asking for support to make existing resources easier to access, navigate, and better meet the needs of low-income single-parent families. Over the 12 months project, outcomes will be evaluated using participation rates, referral connections, and stakeholder feedback to guide future funding and improvements. The need is clear. Just Jane and Finch already have strong community resources. What is needed now is better coordination, sustainable support, and leadership committed to action. Now I back to Elisa. Elisa?
Thank you, Amile. The Jane and Finch initiative aims to reduce barriers and better connect single parent families with the resources they need. Therefore, we are asking Toronto Public Health to support and fund this initiative. So for Community Health News, I am Elisa Hammond. On behalf of Arvinda, Stacy, and Hamile, thank you for joining us tonight.